Long before European settlers arrived in North America, indigenous peoples had developed one of the most sophisticated systems of plant medicine on the continent. Over centuries of careful observation, Native American healers documented hundreds of medicinal plants. They understood which roots to chew for pain, which bark to brew for fever, which leaves to apply for wounds, and which berries to avoid entirely. This knowledge was not written in textbooks. It was passed orally from healer to healer, generation to generation, for thousands of years. When European settlers arrived, many of them survived their first winters, only because indigenous communities shared their plant medicines with them. And here is the remarkable part. When modern scientists tested these plants, they found that Native American healers had identified some of the most important pharmaceutical compounds on Earth, centuries before Western chemistry existed. One of those plants gave us aspirin. This is educational content, not medical advice. Always consult a qualified healthcare professional before using any herbal remedy. We also want to respectfully acknowledge that this knowledge belongs to indigenous communities and was developed through centuries of sacred practice. Today we are covering 20 plants that Native Americans used to heal, and what modern research shows about each one. Stay until the end, because number 20 is the plant that literally built a billion-dollar pharmaceutical industry. If you are new here, welcome to the Green Domain, where ancient wisdom meets modern science. Make sure to hit that subscribe button so you never miss a video. Let us begin. Number 1. Echinacea, the snakebite remedy. Echinacea angustifolia was one of the most widely used plants among the Plains tribes. The Cheyenne, Lakota, and Comanche used it for colds, infections, snake bites, toothaches, and as a general immune tonic. They chewed the roots, brewed teas, and made poultices for external wounds. The Lakota specifically used Echinacea for snake bites and rabies. They would chew the root until their mouth went numb, then apply the chewed root directly to the bite wound. The numbing sensation was caused by alchemides, compounds that modern immunology has now confirmed interact directly with the immune system. Here is an interesting twist. In the 1950s, a Swiss doctor traveled to America to study Echinacea. He took seeds home but accidentally brought back the wrong species, Purpurea instead of angustifolia. German researchers ended up studying Purpurea, which became the species sold worldwide. The species with the deepest indigenous history ended up with the least modern research. Despite that, a 2014 Cochrane review analyzed 24 double-blind clinical trials and found that Echinacea preparations reduced the duration and severity of colds compared to placebo. The compounds alchemides and polysaccharides have confirmed immunostimulatory effects. Number 2. Passionflower, the calming vine. Passionflower, Passiflora incarnata, was used by the Cherokee, Homa, and other southeastern tribes as a sedative, a treatment for anxiety, and a remedy for insomnia and nervous restlessness. The Cherokee also used it for boils, inflammation, and as an EAR medicine. The plant produces one of the most striking flowers in North America, which is how it got its name from Spanish missionaries who saw religious symbolism in its structure. But its medicinal value goes far beyond its appearance. In 2010, a randomized double-blind trial published in the Journal of Clinical Pharmacy and Therapeutics compared passionflower extract to the prescription benzodiazepine oxazepam for generalized anxiety disorder. The result? Both were equally effective at reducing anxiety, but passionflower had significantly fewer side effects, including less impairment of job performance. A 2020 systematic review confirmed anxiolytic, sedative, and sleep-improving effects across multiple human trials. The Cherokee used this plant to calm the mind. Modern psychiatry compared it to a prescription anti-anxiety drug and found it performed equally well. Number 3. Black cohosh, the women's healer. Black cohosh, Actaea racemosa, was used by the Cherokee and Algonquin for menstrual cramps, menopausal symptoms, sore throats, kidney problems, and depression. The Cherokee also made tea from the root to treat headaches, and they used it as an alcoholic beverage. The root was brewed or fermented for different remedies. It became one of the first Native American remedies adopted into mainstream Western herbal medicine. By the 19th century, it was a best-selling product in the American patent medicine industry. A 2012 Cochrane review analyzed multiple trials and found evidence that black cohosh reduces menopausal symptoms, particularly hot flashes. The studies suggest it reduces the frequency and severity of hot flashes for some women. The German Commission E approved it for premenstrual discomfort and menstrual pain. It is now one of the most commonly used herbal supplements for women's health worldwide, and it traces directly back to Cherokee and Algonquin medicine. Number 4. Goldenseal, the golden wound healer. And this is where Native American plant knowledge starts revealing its depth. Goldenseal, Hydrastis canadensis, was used by the Cherokee and Iroquois as an antiseptic for wounds, a treatment for digestive disorders, and a remedy for skin and eye infections. The Cherokee took root decoctions orally to treat cancer, dyspepsia, and general debility. They also used it as a wash for local inflammations. The key compound is berberine, an isoquinoline alkaloid that has now been studied in over 4,000 published scientific papers. That makes berberine one of the most researched plant compounds in the world. A 2015 meta-analysis in the Journal of Ethnopharmacology found that berberine significantly improves blood sugar control, cholesterol levels, and insulin sensitivity in patients with type 2 diabetes. Some studies have found effects comparable to the diabetes drug metformin. Berberine has also shown antimicrobial activity against Staphylococcus, E. coli, and multiple drug-resistant bacteria. A plant the Cherokee used for wound infections contains a compound that modern endocrinologists are now studying for metabolic disease, and modern microbiologists are studying as a potential answer to antibiotic resistance. Number 5. American ginseng, the life root. American ginseng, Panax quinquefolius, was used by multiple tribes, including the Cherokee, Creek, and Iroquois, to treat fever, indigestion, headaches, fatigue, and infertility. A review published in 2019 in the Journal of Ginseng Research confirmed that American ginseng contains ginsenosides with neuroprotective, immunomodulatory, and anti-diabetic effects. Clinical trials have shown improvements in cognitive function and blood sugar management. American ginseng became so over-harvested for export to China that it is now a protected species in many states. Number 6. Witch hazel, nature's astringent. Witch hazel, Hamamelis virginiana, was used by the Cherokee, Iroquois, and Chippewa for cuts, bruises, insect bites, skin inflammation, sore eyes, and sore throats. Modern research confirms that witch hazel contains tannins and hamamelitannins with astringent, anti-inflammatory, and antimicrobial effects. It is now one of the most widely used natural topical products in the world. Number 7. Slippery elm, the throat soother. Slippery elm, Ulmus rubra, was used by dozens of tribes for sore throats, coughs, wounds, burns, and digestive inflammation. The inner bark produces a mucilage that coats and soothes irritated tissue. A 2018 review in the Journal of Herbal Medicine confirmed that slippery elm has demulcent, anti-inflammatory, and antioxidant properties. It is still used in modern herbal medicine for irritable bowel syndrome and acid reflux. Number 8. Yarrow, the battlefield plant. Yarrow, Achillea millefolium, was used by the Cherokee as an anti-hemorrhagic agent for wounds, for bloody hemorrhoids, fever, and bowel complaints. The genus name Achillea comes from Achilles because Greek soldiers also used it on battlefields. A 2017 review confirmed that yarrow contains sesquiterpene lactones and flavonoids with anti-inflammatory, antispasmodic, antimicrobial, and wound healing effects. 2 continents, 2 civilizations, same plant, same use. Number 9. Saw palmetto, the men's remedy. Saw palmetto, Serenoa repens, was used by the Seminole and other southeastern tribes as a food source, a tonic, and a treatment for urinary and reproductive problems in men. The Seminole ate the berries regularly and made teas from them for bladder and prostate complaints. When European settlers observed this, they adopted saw palmetto into Western herbal practice. By the early 20th century, it was one of the most prescribed herbal medicines in the United States. In 2012, a Cochrane review analyzed multiple trials and found evidence that saw palmetto extract improves urinary symptoms associated with benign prostatic hyperplasia, including nighttime urination frequency and urinary flow rate. The active compounds, fatty acids, and phytosterols appear to inhibit 5-alpha reductase, the same enzyme targeted by the prescription drug finasteride. It is now one of the best-selling herbal supplements for prostate health worldwide, a seminal berry remedy and a modern pharmaceutical targeting the exact same enzyme. Number 10. White sage, the sacred cleanser. White sage, Salvia apiana, was used by indigenous peoples of the American Southwest in smudging ceremonies for spiritual cleansing, but it was also used medicinally for respiratory infections, headaches, and digestive problems. A 2016 review in the Journal of Traditional and Complementary Medicine confirmed that sage species contain thujone, camphor, and cineole, with antimicrobial, anti-inflammatory, and antioxidant properties. We are past the halfway point, and the remaining plants are where indigenous knowledge connects to some of the most important modern discoveries. Number 11. Cascara sagrada, the sacred bark. Cascara sagrada, Frangula pursiana, was used by indigenous peoples of the Pacific Northwest as a laxative for centuries before European contact. The name means sacred bark in Spanish. Spanish colonizers gave the name after learning about it from native peoples. It became a Food and Drug Administration approved over-the-counter laxative ingredient, and for years it was one of the most widely used laxatives in the world. It was reclassified in 2002. Number 12. Wild cherry. The cough medicine. Wild cherry bark, Prunus serratina, was used by the Cherokee and other tribes as an expectorant and cough suppressant. The bark contains prunicin, which breaks down into benzaldehyde, a compound with confirmed antitussive effects. Wild cherry bark extract is still found in commercial cough syrups today. Number 13. Bearberry, the urinary herb. Bearberry, Arctostaphylos uva ursi, was used by multiple tribes to treat urinary tract infections, kidney inflammation, and bladder problems. A 2017 review in the journal BMC Complementary and Alternative Medicine confirmed that bearberry contains arbutin, which converts to the antimicrobial compound hydroquinone in alkaline urine. The German Commission E has approved bearberry for urinary tract inflammation. Number 14. Elderberry, the winter protector. Elderberry was used by indigenous peoples across North America as a treatment for colds, fevers, respiratory infections, and skin conditions. The species they used was the American elderberry, Sambucus canadensis, native to eastern and central North America. The berries were cooked into syrups, the flowers steeped as tea, and the bark used for inflammation. Multiple tribes considered the elder tree sacred and used it ceremonially as well as medicinally. While most modern clinical trials have studied its close European cousin, Sambucus nigra, both species contain similar active compounds. A 2019 meta-analysis in the journal Complementary Therapies in Medicine analyzed multiple randomized controlled trials and found that elderberry supplementation significantly reduced the duration and severity of upper respiratory symptoms in patients with colds and influenza. The active compounds, anthocyanins and flavonoids, have confirmed antiviral and immune-stimulating effects. Elderberry syrup has become one of the most popular natural cold remedies in the world, and its use traces directly back to indigenous North American tradition. Number 15. Osha, the bear root. Osha, Ligusticum porteri, is one of the most revered medicinal plants among the indigenous peoples of the American Southwest. The Navajo, Apache, Zuni, and Tarahumara used Osha root for respiratory infections, colds, sore throats, coughs, and as a general antiviral remedy. The plant is sometimes called bear root because indigenous peoples observed bears digging up and eating Osha roots after emerging from hibernation. And when they were sick or injured, they followed the bear's instinct. And it worked. Osha grows only at high elevations, typically between 7,000 and 10,000 feet. in the Rocky Mountains and Sierra Madre. It cannot be commercially cultivated, which makes it rare and ecologically sensitive. Modern analysis has confirmed that Osha root contains Z-ligustolide, dilligustolide, and other phthalides with antimicrobial, anti-inflammatory, and smooth muscle relaxant effects. Preliminary studies suggest antiviral activity against respiratory pathogens. A plant that indigenous peoples learned about by watching bears turns out to contain genuine antiviral compounds. Number 16. Wild yam, the cramp reliever. Wild yam, Dioscorea villosa, was used by multiple tribes for menstrual cramps, colic, and digestive spasms. But the modern story of wild yam is one of the most consequential stories in pharmaceutical history. In the 1940s, a chemist named Russell Marker discovered that the compound diosgenin, found abundantly in wild yam, could be converted into progesterone in the laboratory. This discovery made synthetic hormones affordable for the first time, and it directly led to the development of the first oral contraceptive pill in the 1950s, a drug that transformed modern society. A Native American cramp remedy provided the chemical building block for one of the most significant pharmaceutical inventions of the 20th century. Number 17 through 19. The wound healers and purifiers. The next three plants share a common thread. They were all used by indigenous peoples for external healing, purification, and protection. Juniper, Juniperus communis, was used widely by southwestern tribes, particularly the Navajo, for urinary problems, respiratory infections, arthritis, and ceremonial purification. The Navajo considered juniper a guardian tree. They burned juniper branches in healing ceremonies to cleanse a space of illness and negative energy. Pregnant women drank juniper tea sparingly to ease labor pains. Juniper ash was mixed with other plants to create medicinal pastes for skin conditions. A 2017 review in Pharmacognosy Reviews confirmed that juniper contains volatile oils, including alpha-pinene and saponine, with antimicrobial, anti-inflammatory, antioxidant, and diuretic properties. Plantain Plantago major was used by multiple tribes to draw out toxins from insect bites, stings, and infected wounds. The Cherokee, Ojibwe, and Mohegan applied crushed plantain leaves directly to bites as an emergency field remedy. A review published in 2013 in the Journal of Ethnopharmacology confirmed that plantain contains aucubine and allantoin, and that these compounds have anti-inflammatory, antimicrobial, and wound-healing effects. Balsam fir, Abies balsamea, was the antiseptic tree of the northern forests. Tribes across New England and Canada applied the sticky resin directly to cuts, wounds, sores, and burns. They also inhaled the steam from boiling balsam needles for headaches and respiratory infections. Modern analysis shows that balsam fir resin contains terpenes and sesquiterpenes with antimicrobial and anti-inflammatory effects. 3 plants, 3 different ecosystems, all used for healing wounds and fighting infection, all confirmed by modern research. Number 20. White willow, the tree that built an empire. I told you at the beginning that number 20 built a billion-dollar industry. Here is the full story. White willow, Salix alba, was used by Native Americans across the continent for pain, fever, and inflammation. They chewed the bark, they brewed it into tea, and they noticed that it worked, every time, for hundreds of years. The knowledge was so reliable that European settlers quickly adopted it. In 1828, a German pharmacist named Johann Buchner became the first to isolate the active compound from willow bark. He called it salicine. In 1853, a French chemist named Charles Frederick Gerhardt synthesized acetylsalicylic acid from salicin. And in 1899, the pharmaceutical company Bayer branded this compound and gave it a name the world would never forget: aspirin. It became the first mass-produced pharmaceutical drug in human history. Over 100 billion tablets of aspirin are consumed every year worldwide. It is used for pain, fever, inflammation, heart attack prevention, and stroke prevention. It is on the World Health Organization's list of essential medicines. The entire foundation of modern pharmaceutical pain relief traces back to a compound that indigenous peoples had been using for centuries before Western chemistry existed. That is the story of aspirin, and it began with Native Americans chewing the bark of a willow tree and passing the knowledge to their children. Before we wrap up, here is something important. Many of the plants on this list, including American ginseng, goldenseal, slippery elm, and black cohosh, are now endangered or at risk due to decades of overharvesting. United Plant Savers, a conservation organization, maintains an at-risk list of native medicinal species that are disappearing from the wild. If you use these herbs, please source them from sustainably cultivated farms, not wild harvested populations. The knowledge that indigenous communities developed over thousands of years deserves both our respect and our protection. And consider this: two of the most important pharmaceutical discoveries in modern history came directly from Native American plant knowledge. Aspirin from willow bark. The oral contraceptive pill came from wild yam. How many more breakthroughs are hiding in indigenous knowledge systems that modern science has never properly investigated? If this changed the way you think about Native American plant medicine, subscribe to the Green Domain. Because next, we are investigating the herbal traditions of the Roman Empire and what modern science has to say about them. Drop a comment and tell me which indigenous remedy surprised you the most. And if you missed our Greek, Egyptian, Ayurvedic, Biblical, and Chinese videos, all the links are in the description. Ancient wisdom, modern proof, real results. I will see you in the next one.